Oh, I almost lost my appetite there eating a little sandwich. Then the Irving media, whatever, what do you call it now? Anyway, here we go again. Addiction services need to focus on street level. Doc. Some doctor. Anyway, so-called Dr.Sara Davidson, the one that went publicly saying that there was a woman that was pregnant that died in a tent, and at the end it wasn't even true. And she never apologized for, telling this story. So I never read it. Again, media, they say the word, what do they say again there? Substance abuse or drug addiction. They don't use the word crystal meth. Now, let's see what's going to happen here. I never read it. Calm down, Charles. Have a drink of water. Do something. Let's see what's going on here. This is the same woman that said people on crystal meth must have housing downtown. A lot of people would like to have housing downtown. They say people with meth heads must be part of the community. Anyway, let's see here. Calm down, Charles. It says below the picture, Sara Davidson, homeless advocate. Want to be homeless. Choose to be homeless. An addiction specialist said it's crucial that the province work to address concurrent disorders. That's a new name, disorders now? And tackle the housing crisis in order to better support New Brunswickers struggling with addiction. See, no, not crystal meth. Charles, calm down. Okay. Addiction specialist. What the fuck is that word? That's a new word. Be politically correct. Excuse my language, but the word fuck and crystal meth goes hand in hand. Addiction specialist hopes the $200 million announced by the provincial government as part of its health budget to focus on mental health and addiction services will improve street level services for people addicted, and are looking for more details. The funding will be specially going into key initiative, according to Bruce McFarland, Director of Communication for Health and Department. I'm still waiting for Jennifer Russell. Anyway, focus, Charles. A mental health telephone line, blah, 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 blah. Sara Davidson, a choose to be homeless, advocate, and addiction specialist. What a fucking name. Based in Fredericton, said she would see a street-level approach for supporting communities who are struggling in downtown areas across the province. I don't see anything in the budget that gives me great hope. I don't see anything in the communication that I had that is showing that there's a current plan. Davidson said, however, seeing addiction and mental health issues on government radar is very exciting and hopeful. Addiction has become an increasing concern across the province in recent years, and with an influx of crystal meth and opiates. Oh, okay, there we go. Crystal meth. First time the media ever mentioned that word. According to Public Health, there were 345 substance-related deaths between 2016 and 2021. In 2020 alone, there were 45 substance-related deaths in the province. Davidson said it's crucial the province work on addressing concurrent disorders when a person suffers from addiction and a mental health problem at the same time. She said that especially working with individuals living in precarious housing situation in the area, she has observed the need for more aggressive outreach plan that address both substance abuse and mental health issues. It's very difficult to get anyone access to treatment for concurrent disorders because there are not a lot of clinics that practice that. MedDoc's executive director echoed Davidson's concern and reason for hope. He said he would like to see money, energy trickle down to the trench level to help communities in need of support. Working with the department, MedDoc said the shelter are looking to develop a specialized facility for people with addiction and mental health issues that face barrier in accessing housing. Yeah, sure. I mean, if you want to piss in the goddamn washing machine, or don't flush the toilet for 3 months, or have garbage pile up till the ceiling, you want that in housing? I don't think so. What we'd like to see as a housing-focused shelter is to be able to put addiction behind them and start living a healthier, more normal lifestyle without having an incredible cross to bear. He said he was excited. $5 million has been allocated for the construction of the Addiction Center in Campbellton. It's something that's very much needed in this province. Any new money into mental health and addiction is great. You know what this is? I'm going to tell you exactly what this is. They're starting to use the Irving media, whatever you want to call it, and start to brainwash the citizen into, they're going to buy that abortion clinic and turn it into a rehab center right behind the George Middle School. That's what this is all about. Stay tuned. And people must fight, and must fight hard, to say, no, we don't want that here.